Hello, my name is John Morris. I'm the Chief Operating Officer and Secretary of the American Thyroid Association. I'm also an endocrinologist and a professor of medicine at the Mayo Clinic, where my job is largely to see patients with thyroid cancer of all types and all severities. I'm here today to introduce for you the American Thyroid Association's thyroid cancer video. Thyroid cancer is a very challenging disease and disorder. Its frequency is increasing quite significantly at the present time, especially papillary thyroid cancer, which is the most common type. The spectrum of thyroid cancer is very broad, arguably broader than any other type of cancer. It ranges from the very common papillary thyroid cancer, which is now in the top 5 most common cancers found in women in the United States, which is very treatable, and most patients enjoy a good prognosis with proper treatment, to anaplastic thyroid cancer, which is arguably the most aggressive and most lethal form of malignancy that humans experience. The American Thyroid Association is a leader in providing funds and effort for research, for sharing knowledge among investigators, and for creating guidelines for the diagnosis and management of thyroid nodules, and especially for thyroid cancer. Our group just completed a revision of our thyroid cancer guidelines, which I believe lead the world in balanced and knowledgeable recommendations for the management of this most common of endocrine cancers. Dr. Bryan Haugen, whom you will hear from in this video, was the leader of that effort, the most recent update. These guidelines are now in their 5th iteration. So I'm very pleased to introduce my colleagues in the American Thyroid Association in our video for thyroid cancer.
Hello, I'm Dr. Michael Tuttle, an endocrinologist at Memorial Sloan Kettering Cancer Center in New York, who specializes in thyroid cancer. I've been a member of the ATA for more than 20 years and had the privilege to serve both on the board of directors and as a member of several of the thyroid cancer guideline committees. This video will take you on a journey through all of the ATA thyroid cancer initiatives, covering the full spectrum of thyroid cancer, from medullary thyroid cancer to differentiated thyroid cancer and anaplastic thyroid cancer. You'll meet patients and family members and ATA physicians who have traveled this journey together. Your support allows the ATA to sponsor research grants and guidelines which impact clinicians and patients not only in the United States, but throughout the world as we strive to cure thyroid cancer. We thank you for your support.
I'm Ann Sosa. I'm a proud and loyal member of the American Thyroid Association. I'm a member of the board of directors of the ATA, and I also faithfully serve on the guidelines committees for both thyroid nodules and differentiated thyroid cancer, as well as hyperthyroidism and thyroid toxicosis. When I'm not working with the ATA, I'm the chief of endocrine surgery at Duke University. I'm an endocrine surgeon and surgical oncologist who leads the endocrine neoplasia diseases group at Duke. Differentiated thyroid cancer is an important public health problem in the United States. Thyroid cancer is the fastest increasing cancer, with an incidence that has increased more than 250% in the last 2 decades. By 2019, it's expected to be the number 3 cancer in American women. And among American women 35 years of age and younger, it is already the number 1 cancer. More than 62,000 Americans this year will be diagnosed with thyroid cancer. Typically, thyroid cancer arises from thyroid nodules, and we think that as many as 68% of Americans have a thyroid nodule. This is an important space for the ATA, which is actively supporting research, training, and even last week marked an important milestone for the ATA. with the publication of practice guidelines for thyroid nodules and differentiated thyroid cancer in the United States to hopefully standardize care and improve patient outcomes. Welcome to the American Thyroid Association Differentiated Thyroid Cancer video. You're about to see a physician speak with a patient who has this disease and about his experiences and challenges.
Hello, I'm Bryan Haugen from the University of Colorado. I'm an endocrinologist, and I'm here with Andy DeBevoise to talk about differentiated thyroid cancer, which is a very common type of cancer, both in men and women. Fortunately, most patients are treated with surgery and radioactive iodine, but there are many challenges along the way, and I wanted to talk with Andy a bit about the challenges that he has had in his thyroid cancer journey. So Andy, what challenges or issues have you had dealing with thyroid cancer?
I was diagnosed in May of this year and had my surgery the first part in June. And part of the surgical process, I had to have my recurrent left laryngeal nerve, well, the words of the surgeon, sacrificed. And so after the surgery, my voice has changed. And it's been a challenge to adapt to that and deal with that. And actually it's gotten much better, and I'll be having some further therapy and some things done with that. So that's been part of my process and part of the challenges. Pulmonary nodules were detected by CT scan when I had septic, when I went back in, because I had to do a CT scan of my chest. And so because my case and my age and the nature of my papillary thyroid cancer, she thought that she would refer me to Dr. Smallridge at Mayo for further consultation. I knew nothing about thyroid cancer, but to find out that the papillary was, I guess if there's such a thing, the preferred variant to have of it, and that the treatment was surgery and then radioactive iodine. But the pulmonary nodules throw another twist into it, plus as I understand, the genetic mutation that I have, they are resistant to the uptake. While I'm incredibly grateful for the care that I have both locally and at the Mayo. It's a journey for me, and the next step now will be a few months from now. We'll take another CT scan and see what's going on. And
Sure.
And so, you know, to be honest, I'm apprehensive.
And what concerns do you have about future treatment or questions or concerns that you have now?
Well, I wonder if I will have to go on the medication, the kinase medications, and the side effects that they might have, and how that might affect my life.
Andy, are there any concerns that you have about the future, either therapy or the future of your thyroid cancer?
Well, yes. I mean, my understanding is that I may have to undergo treatment with medication, the kinase medications, and the side effects from those, which I know can, you know, not be that pleasant. I guess further radioactive iodine treatment is a possibility, and I don't quite understand what all that means. You know, I don't really know what this will mean for me in terms of my quality of life or life expectancy, that kind of thing. I haven't really studied up on that, but right now I'm taking it day by day, and I'm grateful to be back to work and to be under the care of very fine physicians and with expertise in this area.
Thank you, Andy, for those wonderful insights. I think you've really shown that thyroid cancer can be a difficult cancer to treat, and there are still many unanswered questions. As you see, many people don't even know what thyroid cancer is when they're first diagnosed, yet it's a very common cancer. We at the American Thyroid Association are working in many areas, such as guidelines generation, to help guide other physicians and patient care in this area, as well as supportive research to try to understand how we can better treat these patients, either with surgery, the radioactive iodine, novel therapies, and also patient advocacy. So we at the ATA work very hard in many areas to try to improve care and improve lives in patients who have thyroid cancer.
name is David Cooper. I'm a professor of medicine at Johns Hopkins, and I've been a proud member of the American Thyroid Association for over 30 years. I also served as the president of the ATA in 2006 and 2007. You've just heard a very moving interview of a patient with thyroid cancer who illustrates some of the good things and the bad things about thyroid cancer. He illustrates the fact that even though we know a lot about thyroid cancer and there are treatments for thyroid cancer, there are still challenges in the sense of certain treatments that are not yet available for patients like that. We need your help in fostering the ATA's ability to fund research so we can help prevent thyroid cancer and treat thyroid cancer and diagnose thyroid cancer in a better way in the future. Thyroid cancer is one of the most rapidly growing kinds of cancer, and in every developed country on earth, thyroid cancer has now become one of the top kinds of thyroid cancer. Why this is, we still do not know, but research into this is also vitally important. Over the last 10 years, the ATA has given over $2 million to fund research, much of which has gone to study various aspects of thyroid cancer. And partners with the ATA, nonprofit organizations, have chipped in another $1.5 million. So in total, almost $4 million has been distributed to researchers all over the world to help fund research on thyroid cancer. Some of the money has also gone to fund clinical practice guidelines related to thyroid cancer. Clinical practice guidelines are documents that are written by experts of the American Thyroid Association, which go over the proper way to diagnose and treat thyroid cancer in its many aspects. And these guidelines are among the most sought-after references for clinicians who want to learn more about how to best treat thyroid cancer for their patients. The ATA has published guidelines on the management of differentiated thyroid cancer, like Mr. DeBevoise has, on medullary thyroid cancer, on anaplastic thyroid cancer, and most recently, a guideline was published on pediatric thyroid cancer. We need your support for these activities, and I hope that you'll consider donating to the American Thyroid Association through the website, through the mail, or by phone. Thank you very much.
Hello, my name is Lisa Orloff, and I'm professor of otolaryngology head and neck surgery and director of endocrine head and neck surgery at Stanford University. I'm also the current chair of the American Thyroid Association Development Committee, as well as a member of the Surgical Affairs Committee for the American Thyroid Association. In this video, we're going to discuss medullary thyroid carcinoma and what the American Thyroid Association is doing to help promote research, education, and optimal patient care for those with medullary carcinoma. You will hear some patient stories and what you can do to help further the mission of curing medullary carcinoma.
Hello, my name is Manisha Shah. I'm the professor of internal medicine at the Ohio State University Medical Center. I'm a medical oncologist and a member of ATA. I also was involved in the ATA medullary thyroid cancer guidelines that were revised this year. Medullary thyroid cancer, as you might know, is a rare type of thyroid cancer. However, medullary thyroid cancer starts in thyroid, but it can affect many organs such as liver, lungs, lymph nodes, bones, and you name it. So patients who are struck with this diagnosis suffer from many different symptoms, including diarrhea, flushing, as well as the organ dysfunction and ultimately organ failure. So patients actually die as a result of medullary thyroid cancer diagnosis. And today I have Dwight Vicks, who is a family member of a patient who was diagnosed with medullary thyroid cancer. Dwight, would you share your story with us?
Thank you, Manisha. My name is Dwight Vicks, and my wife Jean was diagnosed with medullary thyroid carcinoma in 1999 and was on that journey for 13 years, had 7 surgeries, participated in 2 clinical trials, as well as some cytotoxic chemos. So thankfully we had some wonderful treatment from phenomenal physicians that helped her get through that journey as best as possible.
So ultimately we lost Jean.
We did.
but she's still here because what you and many others are doing to improve the care of patients with thyroid cancer. So Dwight, would you tell us about some of the challenges during this decade-long journey?
I think the first biggest challenge was determining what she had.
Mm-hmm.
And we were very fortunate that we had an FNA at upstate in Syracuse that got the diagnosis right.
Okay.
And once we discovered it was medullary thyroid carcinoma, we knew it was rare, and we started doing a lot of research.
Mm-hmm.
So then the question was, who treats it, who sees the most of it, so we could get the best physicians on her case.
So you had to do the homework yourself.
We did a lot of it ourselves. We're both blessed with a good education, but we also relied on some key physicians to guide us. When Jean was diagnosed, she was 37, and we have 3 children, and our twins, Sarah and Dwight, were 2nd grade, and Emily was in kindergarten.
Wow.
And of course, when you're faced with a major health challenge, you also have to take care of your family. And thankfully, we had a family that could step in to watch our kids while we were off getting our medical treatments, which in both cases were 5 hours away. We went to New York City as well as Boston for her numerous treatments.
So at the end of the journey, we still lost her, but I hear that Jean had great attitude about how she went through this journey. Can you tell us a little bit about that?
Yes, she was an extraordinary woman. She always looked for a silver lining, and when she was diagnosed, she said, how are we going to solve this? And she was a great athlete. She played field hockey in college, and so when she would prepare for her surgeries, it was like a big game.
Wow.
And then when they discovered that the cancer had metastasized on her lungs in 2001, and this was after the 4th surgery, there were no systemic therapies at that time. So her concept was to create a dream team of the best physicians in all the different disciplines that deliver cancer care to come up with some clinical trials for medullary, because there were none at that point. And she was the inspiration of a group called International Thyroid Oncology Group, of which many ATA members are a part of.
That's great. That's great. So at the ATA, we're trying to work very hard on improving the lives of patients and the longevity of lives of patients with medullary thyroid cancer by doing research initiatives, doing education, as well as to improve and develop the guidelines for treatment of medullary thyroid cancer. So thank you very much for considering donating to this important cause.
I'm Steve Sherman. I am a physician who specializes in the care of patients with thyroid cancer, particularly medullary thyroid cancer. And I've worked with the American Thyroid Association for many years on its boards, in various committees, and in the development of treatment guidelines for patients with thyroid cancer. What we've heard so far in this video is a great deal about medullary thyroid cancer, the symptoms, the problems that patients and their families can have with this disease, and the particular and unique problems that they can face when we talk about inherited forms of thyroid cancer, which are quite special to medullary cancer. What we've seen is that there's a great deal that needs yet to be done. Part of that effort has been the devotion of the American Thyroid Association to improving the quality and the standard of care for patients with medullary cancer throughout the United States and around the world. One of the most important parts of that effort has been the development of high-quality, consensus-driven guidelines for the treatment of patients and their families. This has been an effort that's been ongoing in multiple forms of thyroid cancer by the ATA for many years, but in particular, the guidelines for medullary thyroid cancer have been recognized worldwide for their impact. These are efforts that require a tremendous amount of support. And we've, through the American Thyroid Association, are so grateful for the donations and the philanthropy that has helped to underwrite this. But this is an effort that has to keep on going and needs to expand. And so we certainly welcome and look forward to donations that can be made to the organization through our website at www.thyroid.org, through multiple other mechanisms, including by phone and by mail. And we certainly would appreciate any contributions and support that can help for this effort. Again, I'm Steve Sherman. As an endocrinologist and as a proud member of the American Thyroid Association, I thank you for your interest and your support.
Hello, my name is Bob Smallridge. I'm the president of the American Thyroid Association. I also work for Mayo Clinic in Florida, where I am an endocrinologist and the deputy director of the Mayo Clinic Cancer Center. My practice is devoted almost exclusively to thyroid cancer. I'd like to welcome you to the American Thyroid Association's video that has been prepared on anaplastic thyroid carcinoma. This disease is a rare form of thyroid cancer, but it is a deadly form. When patients get this disorder, the life expectancy is measured in months, no more than 4 to 6 months without treatment. And almost all patients do eventually succumb to the disease. The problem we face is that because it's so rare and so aggressive, we have difficulty identifying new treatments that will be effective in containing the disorder and hopefully eventually curing it. Therefore, it is very important that we continue doing research in this area, both in the laboratory and clinical trials, to identify better ways of helping our patients with anaplastic thyroid cancer. I'd now like to move to the video, which is going to highlight some of the challenges which we have at the American Thyroid Association and how our organization endeavors to meet some of those challenges.
Hello, my name is Manisha Shah. I'm the medical oncologist at the Ohio State University Comprehensive Cancer Center. I'm also an American Thyroid Association member, and I was involved in American Thyroid Association ATC and MTC guidelines over the last few years. I would like to focus on anaplastic thyroid cancer. It's one of the most aggressive solid tumors there is. And that's because we see it grow in days or weeks rather than months or years or decades. It causes devastating effect on patient and family who are struck with this illness. As a medical oncologist, we face these challenges every day in the clinic. Today, I would like to introduce a family member of anaplastic thyroid cancer patient. Her name is Mary Catherine Petermann, and her father has been diagnosed with anaplastic thyroid cancer about 9 years ago. So let's hear from Mary Catherine about how her journey was as a caregiver and a family member, and what were the challenges.
Great, thank you. I'm Mary Catherine Petermann, and my dad was diagnosed with anaplastic thyroid cancer in October of 2006, so 9 years ago this month. When we first got the diagnosis, it was devastating, to say the least, confusing and sad, and you're scared and not sure exactly what to do. We went through a series of tests and scans and biopsies, and the first doctors that we went to had never seen anaplastic thyroid cancer before, said that the statistics are grim, you're probably looking at 6 months. So we went to another facility, and we met with another round of doctors there who said that it was growing so aggressively and large and just really nasty that you were probably looking at 2 to 4 weeks for him to even live, and maybe we shouldn't even consider doing treatment. So we didn't like that answer either, and so we went to a third facility, ultimately ended up, by good luck and fortune and everything else, at Mayo Clinic, and with Dr. Smallridge and Dr. McIver kind of guiding us through that process, and working with them was phenomenal. Just the team of doctors that they got on the case immediately, between endocrinology and oncology and radiation, all together just in a matter of a couple of days. And a couple of days can literally make the difference between life or death in a situation like this. One thing, the radiation doctor that we had met with, Dr. Coe, he was leaving for a conference on that weekend, and we arrived on a Friday afternoon, and he could have said, well, great, we'll set up a meeting at the end of next week when I get back. And he spent that weekend okay, hold on, I'm going to get through this, I promise.
So how long the treatment lasted?
So the treatment itself lasted about 7 weeks. That included both radiation once a day, 5 days a week, and chemotherapy once a week for 3 weeks. And the treatment itself is hard, and it's scary, and you hear all these horror stories about chemo and radiation, and you read about, it's literally burning you inside and out, and it's really, it's a really aggressive treatment that it has to be for such an aggressive cancer.
Thank you, Mary Catherine, for walking us through really incredibly difficult journey, but I'm so glad that it's all worth it and that your daddy's doing great.
Yes.
9 years down the
Yeah.
road.
So hello, my name is Steve Sherman. I'm a thyroid cancer specialist. I have had many roles in the American Thyroid Association in development and in guidelines development. And I also take care of patients with thyroid cancer every day of the week. So what we've seen in earlier parts of this video is the challenge of being diagnosed with anaplastic thyroid cancer, what the impact is on patients, on families, and how difficult it sometimes can be to find the best care, to find the specialists, to find the physicians who can provide care. We've gotten a sense of the need for new and effective treatments, treatments that will make a difference in improving the lives of patients, and hopefully treatments that will cure this disease. We've seen the difficulty in finding the specialists who have the expertise to take care of this very rare, this very uncommon condition. And the American Thyroid Association is dedicated to improving the lives of patients with thyroid cancer. It is dedicated, it is working to try to develop uniform approaches that can be provided throughout the country so that we can focus on eliminating anaplastic thyroid cancer in the US and around the world. Through the development of guidelines efforts, the guidelines of the American Thyroid Association for anaplastic thyroid cancer, we have made major strides in moving forward towards developing a uniform, highest quality, best standard of care for patients with anaplastic cancer. Through this effort, the ATA depends upon the generosity of patients, of families, of donors to support these kinds of efforts. Support the efforts in research, support the efforts in guidelines development, support the efforts in the education of physicians everywhere. These donations can be made to the ATA through multiple vehicles. Easiest might be the website, www.thyroid.org, or by phone or by mail. But these are opportunities to help to support the American Thyroid Association in its mission, which includes a broad effort to try to attack and defeat thyroid cancer throughout the nation.
So you've just seen all the ATA is trying to do to meet the challenges of patients with differentiated medullary and anaplastic thyroid carcinoma.
So your donations will help research that's absolutely essential to make advances in treatment of thyroid cancer.
Your donations will help us develop new guidelines.
The American Thyroid Association brings together clinicians and researchers to support a broad platform in order to fund clinical practice guidelines, research, and education initiatives. In order to give, please go to www.thyroid.org. Thanks so much in advance for your generosity.